are your instructor. I am Reynaldo D. Adasa Jr. and my colleague here, Mr. Daryl L. Mirason. The topic that we are going to discuss is about the important components of medical first aid. When we say important, it means it is vital. So it vitals because it pertains to save lives. So it is basic life support. So before we go forward, can anybody define what is basic life support in your own idea? In your own idea, what is basic life support? Anybody?
First aid.
Yes, correct. Basic life support. In your any own idea?
Breathing.
Yes.
Survive.
Yes, correct. Thank you. So now we go forward to the next slide.
So this is our intended learning outcome. At the end of this course, student must be able to define what is basic life support, explain the ABCs of life support, describe what is artificial resuscitation and cardiopulmonary resuscitation. Last one is demonstrate proper procedure, artificial resuscitation and cardiopulmonary resuscitation.
So what is basic life support, or the BLS in short? So basic life support refers to the maintaining of an airway, supporting breathing and circulation with the help or with the techniques of artificial resuscitation and cardiopulmonary resuscitation or CPR. So this is the meaning of BLS. So the picture that you have shown here is an example of an artificial resuscitation. And the next picture, which the lady is giving a compression, that is an example of an CPR or the cardiopulmonary resuscitation. So we will discuss it later, the procedure of these two basic life support.
Okay, here the next slide is explain ABCs of life support. So anyone can define what is A stands for? Airways. See? Airway. So airway is, we should check open airways, possible obstruction, so you need to easy heat tilt and chin lift. So you must have this heat tilt and chin lift. So must use your two hands. So tilt, and then little bit easy chin lift. Make sure that you will not injure the neck, because nobody knows if victim is unconscious, maybe asleep, maybe he has a back injury or neck injury. So next, anyone can guess what is B stands for?
Breathing.
Breathing, that's correct. Breathing. So in breathing, what is usually checked here, of course, is the breathing of the victim. Next, so look, listen, and feel. So when you are checking the breathing of the victim by mouth or by nose, so you must place your chin near to his mouth and nose to feel the look. At the same time, his chest, if it is up and down, so if he is breathing or not. And you just listen. Listen. If it is a breath, you can hear the sounds. And also feel. You can feel the air coming from his mouth and also to his nose. The next one is letter C. What stands for letter C?
Circulation.
Circulation, that is correct. So circulation, so we are checking here is the important for the pulse. So checking for the pulse. So anyone can guess what is the most important pulse to check if the victim have if it is unconscious. Usually we are using the carotid pulse. Here below the jaw or near this Adam's apple. So it is near to the heart. You can feel it, or sometimes here on the chin also. Can you check here also? You can feel it. Okay, next slide show.
So what is artificial resuscitation? So artificial resuscitation refers to a mouth-to-mouth procedure that performs to a patient that needs a breathing. So not tongue to tongue, ha? It's a mouth to mouth. So it's a stimulating respiration in which to the victim that blows air towards the lungs. So this AR is you give air towards the lungs of a victim. That is artificial resuscitation.
So the next here, what is CPR or cardiopulmonary resuscitation? So it is an emergency life-saving procedure that is done someone's breathing and heartbeat has stopped. An emergency procedure consisting of chest compression, often combined with artificial ventilation or mouth-to-mouth in effort to manually preserve the intact of brain function. So when giving this CPR, anyone, what is the ratio when giving CPR to the victim? How many compression and how many blows? 30 compression and 2 blows. So as per AHA or American Heart Association, or even here, DOH, Department of Health, so the proper giving to the victim CPR is 30 compression in 2 blows, but we still have this compromise, the 100 compression per minute. So it means it's more than 3 cycles for 1 minute. So much better 4 cycles in 1 minute. So giving this 30 compression and 2 blows. Next slide, please.
So now, the next topic that we are going to discuss is about the procedure of artificial resuscitation. So can we watch the video carefully?
Sometimes a person is unable to breathe. In this case, you should begin artificial respiration. Afterwards, making sure that the patient's airways are not blocked by airborne bodies. The most important is mouth to mouth. You should place consciousness on his back with the head tipped backwards. Use your thumb and forefinger to pinch the nose shut. After a deep inhalation, put your lips around the lips of the unconscious person and breathe out slowly until the person's chest rises. The volume of one breath should be no greater than a normal breath. Continue artificial respiration until normal breathing is spontaneously restored, or until the emergency medical personnel take over from you.
So what have you observed from the video? So what is the first step or of the artificial resuscitation?
Just assess the patient
Yes, correct?
for airway.
Yes, correct? Anyone?
For obstruction.
Yes,
Observe
Correct.
the-
yes, correct?
They give to initial 2 blows.
Yes, all your answers is correct. But the procedure in the video is they put first safety gloves before checking the airway, because if you check the airway if your hand is not clean, you are contaminating the victim. So it adds another problem to the victim. Okay? So now I will discuss the ratio of the artificial resuscitation. So artificial resuscitation is you give one air blow, normal air blow, for 5 seconds. And that is 12 cycles in 1 minute. And the other one is 2 air blows for 10 seconds and in 6 cycles in 1 minute. So I want everybody to follow me the procedure of the artificial resuscitation. Okay, just follow me. So I will give now 1 air blow, 1 and 2 and 3 and 4 and 1. 1 and 2 and 3 and 4 and 2. And so on. That is the first procedure. The next procedure is you give 2 air blows. So this is the one. Follow me. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9. 1. 1 and 2 and 3 and so on. That is in 6 cycles in 1 minute. Then after that one, you will wait until the advanced medical assistance or the victim has is revived also. So you must stop your artificial resuscitation. So next, and also, in case you observe that the victim still no breathing and no pulse, that would be discussed in the next slide.
So, demonstrate proper procedure of cardiopulmonary resuscitation. So, in this case, we know that the victim has already no breathing and no pulse, so we will proceed to CPR. So, this is the video when conducting proper procedure for CPR. Video, please.
You arrive on the scene, check the scene for safety. Check the victim for consciousness, gently tap the shoulder and check.
Are you okay? Are you okay?
If no response, call 911 immediately.
You, call 911.
If the adult is lying on their stomach, turn the mobile to their back. They should be lying on a hard, flat surface. Check for breathing and signs of life. Watch their chest for any normal movement. Look for signs of life and breathing for no more than 10 seconds. No breathing or signs of life, begin CPR. Position the heel of one hand on the center of the adult's chest. Place your other hand on top. With your elbows locked and arms straight, lean over the adult's chest and compress the chest 2 inches in depth, 30 times.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
After 30 concussions, give breaths. Give breaths by tilting the head back, lifting the chin, and pinching the nose. Place your mouth over theirs and give 2 slow, gentle breaths, just enough to make the chest rise. Continue with 30 compressions and 2 breaths.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Continue CPR until you see signs of life, another respirator takes over, or help arrives.
So, as you see the demonstration of proper procedure of conducting cardiopulmonary resuscitation to the victim. So, any questions regarding this video? No questions? So, let's proceed to another slide, please.
So now we will recap our topic. So please identify the ABCs of life support. We start with the head tilt and tube lift.
Airways.
Yes, correct. And how about the LM, the look, listen, and feel?
Breathing.
Yes, correct. And for checking or check pulse?
Circulation.
Yes, you are correct.
Okay, identify the features below.
resuscitation.